www.healthcmi.com. Acupuncture continuing education online today. Acupuncture reverses hand paralysis and spasticity. This article was published April 5th, 2020 at healthcmi.com. So simply go to healthcmi.com, click on news, and take a look at the article. Let's take a look. Acupuncture restores hand function in patients with hemiplegia. Foshan Jianshang Hospital in Guangdong researchers conclude that active motion acupuncture significantly improves outcomes for patients with hand dysfunction due to hemiplegia. The researchers document improvements in motor function, reductions in spasticity, and overall improvements in activities of daily living. So, if half your body is paralyzed due to a stroke, for example, then this is one application. This is unique. It's using a combination of two classic acupuncture points in most settings, Naguan and Daling PC6 and 7, plus two master tongue system points, which are local points on the hands, Chengzi and Chengshang, also known as 22.02 and 22.01. And we have a nice photograph at healthcmi.com to take a look at those points. If you click on news when you're there, you can take a look at what those points look like. Also, there are some other points for spasticity, including Sifang, Baxie, Waiguan, and Zhongshu. So that would be some classic points, some extra points, and triple burner 5 and triple burner 3. But what they find here is that if patients just get physical therapy, physical rehabilitation training, they get results. But when you add acupuncture into that treatment protocol, there is a dramatic improvement. And they had all kinds of stages. They measured improvements on the Brunstrom stages of motor recovery. They did the modified Ashworth scale, the Fugel-Meyer assessment, activities of daily living scale, etc. Sample size of 70 patients. Pretty good study. Looked at specific points and got results. This is no surprise. I'm Adam White, licensed acupuncturist. I want to introduce myself a little today. I had the good fortune of working with Master Ming-Ching Zhu, of course, with the scalp acupuncture. He's very well known for that. And he gets great results with scalp acupuncture. Here we are looking at something a little different with local acupuncture, but a combination typically of local and distal points are usually the standard, including scalp acupuncture with hand acupuncture for hemiplegia in the hand. So the scalp acupuncture, I mentioned that with Ming-Ching Zhu because the very first time I saw him, this is a long time ago, I walked by one of the treatment facilities at Five Branches University of Traditional Chinese Medicine, and I said to then director Ken Perlman, I said, Ken, what's going on in that room? This guy's amazing. He's getting results. It was a big clinical theater. People were filming it. It was wonderful. He said, well, he's really good. So I just stopped everything. I was on my way to somewhere, which I thought was important, I guess. Canceled everything, sat in the room and watched, and spent the rest of the day in his clinic. And I was amazed. So I spent many years studying his system and working with him. Years later, I arranged for him to be a full-time professor at the school when I was working there in administration, and even had the good fortune of co-teaching classes with him and arranging seminars for him, because the scalp acupuncture for these types of problems is probably the lead. And then you supplement with these distal points. But here this study is going right for distal points, which I also like. And sometimes, now some other systems will even do electroacupuncture from the scalp to the distal points on the hand. But very interesting. And now they're using proprietary master tongue points in this study, a whole other system. So keep in mind that there is standard acupuncture, but then Ming-Ching Zhu expanded scalp acupuncture, which is a microsystem. In other words, all the acupuncture points that cover the whole body are also in different zones. So some are on the hand or foot or by the ankle or in the ear, on the outer ear, or on the scalp. And that's called microacupuncture. So he's an expert in one of the 8 forms of scalp microacupuncture. There are 8 major forms. Most acupuncturists learn 1 or 2 in school. And then there's some proprietary systems. And I definitely subscribe to Professor Ming-Ching Zhu's system because I think he really has spent a lifetime perfecting scalp acupuncture. I also recommend from my personal experience and seeing the experience of many others who are lucky enough to work with him and see the results in patients. And this is one of those things that can really bring a tear to your eye when someone comes in, let's say even with hemiplegia in the leg, and they are wheeled in and they walk out. We keep in mind, and Professor Ming Qingzhu was very clear about the times. In general, if someone sees you between 24 and 72 hours after a stroke, we can get somewhat profound results off him. Now, you have another window, about a week, where you get pretty good result. Another 2-week window where you can make some excellent result. But finally, that 3-week window, you're still in the zone where you can move forward at a rapid pace. After that, it can be very slow going. And I've seen a few exceptions to that. I remember once I had a patient come in who was somewhat blind in one eye and couldn't move the right arm at all after a stroke. And I said, well, how long? He said, 1.5 years. I said, my goodness, the 3-week window, you're way outside of that. But I gave the treatment anyway. His wife was there. They said, well, just give it a shot. I said, okay, but usually it's very slow going. I don't want you to have high expectations. Within 3 or 4 months, we had restored his eyesight, and his hand was working relatively normally. I'd say about 90%. And I said, look, you're a very, very lucky man. This is not typical with acupuncture, but fortunately, we were able to activate, we say, the qi and blood in the channels to get the job done. But this is not standard. But he, again, was very lucky. And I've seen this with things like other types of disorders where typically we expect a slower response, but they can do well. The opposite, unfortunately, is true, where we expect rapid response in some patients where it can go slowly as well. So it does happen. So even if it's been a while, it's always good to get in the battle and fight. Now, what's important here is that this study used local points, but they also did a lot of passive and active motion of the hand and arm during the needling process, which is described in this article. So if you go to healthcmi.com and click on news, look for the article entitled Acupuncture Reverses Hand Paralysis and Spasticity for the specifics of what was done during the treatment. But basically what we do is we are needling the points, and sometimes we pull them out all the way or almost all the way, and then have them move and then manipulate them a little bit when they're in while they're moving passively or actively, and slowly start restoring motion into the hand. We see a lot of good results with this. It's really a wonderful thing, because even if you take away both hands, obviously it's tragic from someone. But even one hand, it's amazing how many things we take for granted, just opening an envelope or going to the bathroom or cleaning or lifting anything. It's amazing how we need both of our hands. And if you take one of them away, or even if you diminish the motor coordination in one of them, how difficult life is and how time-consuming basic activities become. So this is really restoring abilities to people to live their lives, and also efficiently, so they can get things done, even sit at a desk and get some things done, or operate a computer more easily. So these are the kinds of things that are very important with this type of acupuncture, and it is definitely worth a try. There's manual acupuncture, electroacupuncture, distal acupuncture, and local acupuncture, and of course scalp acupuncture for this. This specifically zoomed in on distal, and they got some good results. Again, all those scales I measured of measurement, fugal mile assessment, etc., everyone did better when they had the acupuncture as opposed to just physical therapy monotherapy. So again, physical therapy is very good, but when you add in acupuncture, that really is the appropriate protocol for hemiplegia and most forms of paralysis. I would say that any treatment protocol for paralysis due to something like a stroke is deficient if it does not have acupuncture. It's just such a tried and proven method of restoring sensory and motor function. There are many other articles, a lot of research at healthcmi.com in the news department you can take a look at on this topic. This one's a lot of fun because it has that nice graphic in there on finding these master tongue points, which were a little extra points that we don't normally see. And if you're an acupuncturist and listening, I want you to think of Chung Shan Double Saint or 22.02, that master tongue point, as, think of it kind of like a Yao Tong Shui type of point because of its location. When you look at the picture, you'll see what I mean, that it's almost like moving Yao Tong Shui over one finger. And Master Tong had a way of doing things like that. Most acupuncturists think of Yao Tong Shui as 2 points. In reality, there are 3 Yao Tong Shui points on the hand, and that's in, you can look that up at healthcmi.com and take a look at the third one. I would say that Master Tong really had developed a 4th, which is this one. So it is also used for back pain, which is very interesting. So that's a treatment aside that people can think about. Again, thank you for listening. I hope everyone can put this to good use, get some good care, and stay healthy and strong. Thank you for listening. I'm Adam White, licensed acupuncturist, www.healthcmi.com.